Jhpiego has been operating in South Africa since 1995. 2007 we established as a legal local entity, so registered as an independent organization, still affiliated to Jhpiego Corporation, and Jhpiego Corporation obviously affiliated to Johns Hopkins University. We program on a continuum of care from pre-pregnancy right up to under 5, and according to our vision, looking at saving lives of women, men and children across Southern Africa. We work in the most vulnerable population, so therefore in rural districts, addressing the needs or health needs of women, men and children in the poorest of the poor communities. On a continuum of care, obviously wanting to save the lives of women and children, we then responded to a request from National Department of Health to implement a program on contraception and fertility planning, but more specifically subdermal contraceptive implants and scaling up of subdermal contraceptive implants, but also providing the client a broader choice of family planning methods. Subdermal contraceptive implant program is being implemented across 9 provinces, and the main objective was providing technical assistance to National Department of Health to roll out the SDCI strategy across the country.
Providing technical assistance is advisory, and working with government and civil society can be quite challenging. So on my work plan, the objectives would be training in the 9 provinces, supply chain management, monitoring and evaluation, advocacy and collaboration. I would just like to highlight training, where I've worked in the 4 provinces and so far trained 95 healthcare providers, and to date we have 4,000 insertions. Jhpiego South Africa is expanding technical assistance to the regional training centres to ensure sustainability post-project closeout. One of the main challenges is the Ndhlalambi circular, which was released 13th October, and it summarizes the new prescription of subdermal contraceptive implants, whereby it is advised that women who are living with HIV, women who are using anti-epileptic medication, anti-TB treatment, are not supposed to use the subdermal contraceptive implants. And advised by the National Department of Health is that alternate methods should be prescribed for them, like the intrauterine contraceptive device, Depo-Provera, or oral contraceptives. How did Jhpiego respond to this circular? Jhpiego responded and said that counselling skills of providers should be strengthened to provide women with multiple choices and allow them to make an informed choice, and emphasize dual protection. Implanon, it must be remembered, is a highly effective long-acting reversible contraceptive method, more than 99% effective. We do not advise that the Implanon should be removed for those women as mentioned before, but that we rather advocate for dual protection. We focus on the rights-based programming, allowing women to make that choice, and it should be an informed choice. So should women still prefer to use the subdermal contraceptive implant, they can use it provided they use dual protection. The benefits of subdermal contraceptive implants are it's a long-acting reversible method. It stays in for 3 years, and therefore women don't even have to worry to go back to the clinic for a repeat of injection of the oral contraceptive as it would be in the past. It is safe to use, it is private, it protects against unwanted pregnancy. Worthwhile to mention, it does not protect against HIV, so therefore women should use dual protection, either using male or female condoms. The continued use of subdermal contraceptive implants, which is a long-acting reversible contraceptive method, will not only benefit the women but also the staff working in the facilities, primary healthcare facilities that is, because it will relieve the workload in their clinics. Now let's talk about the side effects, which really is very minimal. We're looking at headaches, nausea, abdominal pain, dizziness, and these side effects can be easily managed by the healthcare provider. So subdermal contraceptive implants will assist women with healthy timing and spacing when using it effectively and continuously.
From an M&E point of view, one can measure impact at very many levels. For starters, you can look at the engagement activities in terms of technical assistance to the provinces. There were various meetings that were held on a month-to-month basis in terms of organizing training. There were the trainings that were conducted, which numbered 95 of them, where health workers, especially professional nurses, were trained and were highly competent and proficient in providing subdermal contraceptive implants to the beneficiaries. And then when we look at the beneficiaries, we have over 4,000 women that were inserted with implants within the various facilities in the 2 provinces where the training has happened. We had about 4 trainings that have been conducted with such a high number of outputs. And when you look at the women that have been inserted with the implants, you find that these are 4,000 potential pregnancies that have been averted. And this is quite good for the national family planning policy and also the beneficiaries, especially the families which these women belong to.
Jhpiego South Africa would like to thank the National Department of Health, the Regional Art Training Centres, Jhpiego Corporation, in particular the Senior Vice President Ron McGarrick, for facilitating the funding for this project. Bill and Melinda Gates Foundation for funding the project, all other developmental partners and suppliers for making a change in the lives of men, women and children.